Welcome to Black Health Matters. I'm your host, Darryl Armistead. Welcome to Black Health Matters. This is a weekly video podcast that's distributed over a variety of podcast channels. You will find a new edition of this podcast every Monday, and I hope to see you again and again. If you like the content that you find in this series, please like, share, and subscribe. If you're on YouTube, be sure to click the bell to be notified of future uploads. Black Health Matters focuses on health issues of the Black community, as we often have specific concerns that are not always reflected in mainstream health news. My guests will include Black doctors who are best able to address these concerns. If you have topics that you'd like to be addressed, please drop a comment, and I will try to bring on a doctor to the show to discuss the topic. My guest today is Dr. Monique Howard. How are you, Monique?
Fine, thanks. How are you?
Thank you. Thanks for being on the show. Monique is a board-certified pediatrician specializing in adolescent medicine, pediatrics, and neurology. She's a graduate of the University of Louisville School of Medicine and has practiced medicine for 28 years. So welcome to Black Health Matters. Glad to have you. Okay, now our topic today is understanding vaccinations, which is really important given the prospects of a COVID-19 vaccine being released in the near future. And many people are eagerly awaiting the release of a vaccine to bring things back to normal. However, 35% of Americans say they won't take a COVID-19 vaccine, and 58% of Black Americans say they won't take it. And these are recent surveys. And much of the anti-vaccination climate has been created by misconceptions and misunderstandings. Wouldn't you agree, Dr. Howard?
Yes, I do agree completely with that.
Yeah, and I imagine that as a pediatrician, you regularly have to educate parents about the whole process of vaccinations.
Yes, parents do have a lot of concerns about their children's health, and they want to do the right thing, but there are a lot of vaccines, and there is a lot of really misinformation, wrong information that's available. So you have to make sure you understand who's putting out that information and what their agenda is. So to go to a good source would be, of course, to talk to your primary care physician or nurse practitioner, and then go to cdc.gov. Even though it's got the government in it, and it is a part of the government, the CDC is the public health arm of the government. They have hundreds of doctors and scientists working for them, and they have studied these issues very completely. You can also go to AAP, American Academy of Pediatrics.org, to get also very good information.
Okay, great. If you don't mind, I'd like to share a little bit of Black history, and this concerns some of the origins of vaccinations development, particularly in the United States. Okay, I'm going to bring up a screen share, and this has to do with, as long as I get the title out of the way, Black History Month. Onesimus spreads wisdom that saves lives of Bostonians during a smallpox epidemic. And this has to do with, in the early 1700s, a century before Edward Jenner conceived the idea of a smallpox vaccination based on the cowpox virus. Smallpox was ravaging the American colonies. And this changed in 1706 when Cotton Mather had a conversation with his slave, Onesimus, about whether he had ever had smallpox back in Africa. And Onesimus described the practice of variolation, which consisted of taking infectious material like pus from the blisters of a smallpox patients and inserting that material through the skin of a healthy person. Now, people still developed severe symptoms and even died from smallpox via variolation, but in much smaller proportions compared to those who acquired it naturally from another ill person. And as this process improved, vaccines were developed that actually prevented disease infections. And so it's got a lot of its origins from Africa, and particularly through a slave called Onesimus. And I found that fairly fascinating.
No, it is fascinating, and it goes to show you that people all over the world have been trying to prevent illnesses, and they made correct observations. They did testing of their own sort with saying, okay, let's try to get you infected and see if this helps prevent getting a worse infection. So that's really great. And it tells, as people of African descent, we've believed in vaccination for a very long time.
Exactly. Okay, I found some common misconceptions about vaccinations on the internet. And if you'd be so kind, I'd like for you to address some of them.
Okay.
All right. So the first one I'm going to put up on the screen for podcast viewers that are watching the video. And of course, this is also an audio format. So I'll read the question. But misconception number one, diseases had already begun to disappear before vaccines were introduced because of better hygiene and sanitation.
Right. So most of the vaccine-preventable illnesses don't really have anything to do with hygiene or sanitation. A lot of these illnesses are due to viruses. Some are due to bacteria. But they still had major outbreaks around the world during the process of improving hygiene and sanitation. So it sounds like it would make sense, but it really doesn't affect the wild type, meaning the naturally occurring, illness. And one of the things that you can still see today is pertussis. Pertussis is part of the vaccine schedule, but it has not been eradicated to this day. They still have outbreaks of it. So just because you have better hygiene and sanitation doesn't mean that you're going to get rid of an illness. And when I say they, I mean we in the United States still have outbreaks of pertussis every year. So it hasn't gone away.
All right, so I guess anecdotally, you could say that a Clorox wipe is never going to replace a vaccine.
No, a Clorox wipe, I'm sorry, it's not going to replace a vaccine, because remember, these illnesses are carried by people, and we spread the illness to each other. So you can, wipe things all you want, but you're not going to, we're part of the pathogens, that illness's life cycle. So yeah, you're not going to be able to clean yourself that well.
All right. Another misconception, that the majority of people who actually get the disease have been vaccinated.
Right. So what happens is the majority of people who get the disease actually have not been vaccinated. No vaccine is 100% that is around today. So what happens is that, the efficacy, how well that vaccine works in each individual kind of waxes and wanes. So like if you say just got the vaccine, then you probably have a better chance of fighting off that illness than someone who had the vaccine 20 or 30 years ago. And I think what happens is that we keep having outbreaks of like measles in college age students. In the 1990s, the first sort of wave of measles outbreaks was due to changes in the scheduling. So they needed another booster. So once we got that sorted out, that worked really well. But then everyone decided, well, I'm going to do my own thing and I'm not going to get vaccinated because the herd, meaning the entire population, is vaccinated. That only works if the entire population is vaccinated. So therefore, the amount of people who are immune went down because they're no longer vaccinated. And once you get a lot of people in a place together, say for Disneyland or Disney World, then, suddenly you have a spread of the illness again. So people like to say, oh, well, everyone else was vaccinated but me. So no, there was a lot of people who were not vaccinated, and they're the ones who are going to get the illness.
Right. I think if anything that COVID has taught us, when we looked at the very small numbers that we had in January and February, it quickly gained a lot of traction because infectious diseases do spread very rapidly.
Right. And actually, COVID is due to coronavirus. And coronavirus is one of the viruses that can cause cold symptoms. Sometimes cold, sometimes GI, like vomiting and diarrheal illnesses. And those spread really rapidly. They're very efficient at spreading. So even though we started off with low numbers, even if it's at 2 people, you should have been thinking, well, maybe we're up to 20 people and we just don't know it yet. That's why it spreads so rapidly, because it's an inefficient virus.
Okay. Another misconception. There are hot lots of vaccine that have been associated with more adverse events and deaths than others. Parents should find the numbers of these lots and not allow their children to receive vaccines from them.
Okay, so there's no really such thing as a hot lot. Because of the way they make vaccines, scientists study the vaccine along each step that it's made. And so they take care of mostly all of the adverse effects that are reported during the studies at that time. So when you spread it out to the larger community, that's when you can say, yes, most people will get a fever or redness at the site or some muscle aches. The vaccine lot number, the parents will never find that, because there's a complicated series of numbers and letters made by each company. Those are recorded by your physician or the health department when you get the vaccine. So you don't have to worry about checking out these lot number things, because it's going to be kind of difficult for you to find it. Furthermore, there is a vaccine adverse event reporting system called VAERS, Vaccine Adverse Event Reporting System. And when, as the provider or the person who gives the vaccine gets information back from the patient saying that something happened, they will report it to the system. Now, of course, other people can make reports too, but what you have to understand is that the vaccine reporting system, they follow up, and they will follow up with you from like a month later to 6 months later, depending on what you said happened to that person with that vaccination. Because if it is something that was not discovered during the process of development, they really want to know about that. So they will check up on you to see what happens. And sometimes when things happen to people, you relate it to something that you can pin to a date. So say you got the vaccine on Monday and Thursday you had a car accident. Well, some people will say, well, it caused the car accident that resulted in a broken leg. And the two are not related actually at all. But you remembered, oh, I got a vaccine. That was a different thing. Or say you have a teenager who got a vaccine, waited the 20 minutes, because teenagers are known to be, frankly, kind of dramatic, and they will faint just because they hyperventilate themselves worrying about the vaccine. So we have them sit and wait. So say someone waited the 20 minutes, she didn't pass out in the office, and people do pass out sometimes in the office because they worry themselves so much. Then they went off in their car and they had an accident. And so somebody will report that. But then they call and they check at where the person got the vaccine and with that person, like, you waited the 20 minutes, are you sure? I don't think the vaccine caused your accident. I think, were you reaching to change, something, the radio station, or you're fooling with your phone? So you have to kind of take everything with a grain of salt. And you can actually look at the vaccine adverse reporting system, and, they will tell you, like, this person said this happened, and they said this happened. Some people have, especially like with the HPV vaccine, they would make up people, put them into the adverse reporting system, not knowing that, oh yeah, someone's going to check on you to see, does this person even really exist? And then they will say, this person did not exist, was a false report. Mm-hmm. So as a parent, no one wants to give your child anything that's going to harm them. There are systems in place that we do report events, and I've reported events for vaccines several times. It doesn't happen often, but when it does, it's enough that you report it, and they do check up on you. They do follow up on that person.
Right. It's interesting about those car crash. The vaccine made me crash my car. How many of those stories wind up on social media and other people believe them? So I guess the cautionary tale is, please don't believe most of what you read on social media.
Right. My mom always said, believe only, some of what you see, none of what you hear. Right. So, you kind of have to think about, are they being dramatic? Like, what's going on? Because that's how it's all really just a rumor. Yeah. So you need to go back and figure out, like, an appropriate source to get the correct information.
Right. Okay, the next misconception, that vaccines cause many harmful side effects, illnesses, and even death, not to mention possible long-term effects we don't even know about.
Okay, so what happens is, as I said, when they go through the process of making the vaccine and studying it in the clinical trials, they start, at the small part with the vaccine. Then at each step, they broaden the horizon until you get to the clinical trials. And so you start with a fairly large number of people. Most of the time, it's around 10,000 to 20,000 people. You try to get more than that. And they do study the side effects. The universities and study sites that do study vaccinations record any event that the parents say that happens, like if there was a hospitalization, if the child had an ear infection, if, say, the adult had a headache. That's why all of this gets reported. So even if it said someone died, they could have died just during the trial because they were very ill from something else, or they were, elderly and passed away. So everything is always looked at by a clinician again to see, is this an event you can say happened because of the vaccine? Is it directly related to the vaccine? It's like, no, Mr. Jones was, this age in this condition of health, and he passed away due to, this illness or event. The long-term side effects that people are concerned about, I think, mostly comes from the misinformation about the MMR. The MMR, that the studies that said it was related to autism originated in England, and that researcher was actually paid to say that the MMR caused autism. Mm. So, yeah, you would hope that scientists couldn't be bought, but yes, they're people too, so yes, they can be bought, some of them. I think what happens is that once we know even like a developmental problem is out there, once you go looking for it, then you can find it. So, we've known about autism for a long time, but in its most severe forms, not so much so in like the mildest forms, such as the Asperger's syndrome. So now we're looking for it. And because it's a developmental process, we look at it very closely. We're checking for things like this now. So the moms of the kids, especially if they had Asperger's, might have said, well, my child, I don't think he likes me. He doesn't look at me. And, we're like, well, at that time it could have been, okay, well, we'll just wait and see. But that's a clue. And by the time the kid is 1, they're supposed to be doing all these things. And even if you've never had a child before and weren't really around children, you start looking at other 1-year-olds and you're like, well, my kid doesn't do that, but they're doing this. And so something might not be right developmentally. And it's around the time that you're 1 year old, unless there's an outbreak, that you get your MMR the first time. And like I said before, you kind of pin things on an event that's not usual. So you don't get vaccines every day. So you're like, oh, wow, they were 1, they got this vaccine. Aha, it was a vaccine. When it's like, no, that's just coincidental. It's like the child has been having developmental problems that were very subtle, maybe not picked up all along. But when it comes to the 1-year-old, you're supposed to do these things, and now you're not. And now that's when your pediatrician most likely will say, maybe we need to look closer at this. And it has nothing to do with the vaccine at all.
It's a very common theme among anti-vaxxers or the anti-vaccination community on social media, that one of the things they commonly say is that vaccinating your child will cause autism, which is based on bad information. But unfortunately, a lot of people believe that.
Right. And unfortunately, they believe people who say they know things because their kid had something. But I'm thinking of Jenny McCarthy, who was a Playboy bunny. So she wasn't a scientist, and she wasn't looking at a lot of little kids before she had her child. So she's not one to really get this information from. So what happens is that when parents come in, they'll tell me things like, well, I have 5 kids and I've never seen this before. Well, I've seen thousands of kids. And as a collective whole, pediatricians have seen millions of kids. So the broader scope that, scientists and doctors looking at overall, we're overlooking like millions of kids and millions of dosages of vaccines. So when we tell you, look, this is not causing this behavior or this developmental delay, we really mean it. If we thought that it had any way caused it, those vaccines would be given in different ways. We would have said it. But you got to also remember that most of the people, adults saying these things, they probably have their MMR. It's like, you guys don't have autism. You probably don't know a lot of people your age with autism. So kind of think a little bit rationally, like, well, wow, I had that vaccine. So what's going on here? And it's not like, oh, suddenly all my kids have these things that I didn't know about. Well, it's like also, are you sure? Did you not have a family member who is this a little bit different or a little bit special in some way, according to your family, or, someone that maybe no one talked to you about? Because sometimes families don't talk about these things.
True.
So, and I firmly believe that autism is, it's a genetic predisposition, and they're one day going to sort it out to where it is in the genome. But you kind of have to take a step back, because it is very stressful and it is easy to blame one thing when there's probably nothing to blame. No one did anything wrong. And so, just know that if we thought at all things were going to happen because pediatricians do not want to harm children, we would have stopped giving that if it in any way harmed people.
Right. Great information. Okay, misconception number 5. Vaccine-preventable illnesses have been virtually eliminated from my country, so there is no need for my child to be vaccinated.
Right, I hear that a lot too. So there is still the wild type virus out there that can cause illness. And this goes back to that question of herd immunity. So if everyone does not get vaccinated, then there's no herd immunity. Furthermore, the world is a much smaller place. I mean, I was in a small corner of rural Illinois on the Indiana border, and we were less than 40 miles from a city with international students. And if you go anywhere, you get on a plane, you can be anywhere in the world within at least 24 hours. So just because you think you're in a small, safe little corner doesn't mean that other people aren't moving all over the place, visiting and coming to live and doing what they have to do. And, so that's not true at all. And if in virtually eliminated, doesn't mean gone. Like the only vaccine preventable illness that has been declared gone is smallpox. And that's because they had really intensive vaccination efforts until the 1970s. And even then, the smallpox virus itself is not gone. It's hidden away in a lot of labs around the world, unfortunately, and it could be weaponized. And just within the past 15 years, they were afraid that it was going to be weaponized, and people had to, healthcare providers went about getting their smallpox vaccines, boosters again.
That is a scary thought about weaponizing smallpox.
Yeah, and so you can't believe that the virus is gone or the bacteria is gone. It's kind of not.
Okay. The next misconception. Number 6, giving a child multiple vaccinations for different diseases at the same time increases the risk of harmful side effects and can overload the immune system. Sounds logical, but...
It sounds logical, but you have to think about it. You have millions of bacteria on you all the time. No need to get freaked out. They're part of your system, your biome. But, sometimes they can make you sick. You get cuts, scrapes, and bruises all the time. So if you're that delicate that you can't handle more than 2 things at once with your immune system, we would all be very, very sick or dead. And some people do have immune deficiencies that they're born with, and they cannot handle, all the input from the world. Your body is really an incredible machine that is adaptable. So the information your white blood cells get, because they're the ones that fight illness, they get pieces of the virus or bacteria called antigen, and they make an antibody. And they store that information. And so there's always a certain number of cells that are roaming around your body that can clean up something if, you get an incursion. And they can also make more of themselves and spread that information to other white blood cells. So, your body is protecting you all of the time. So it doesn't really increase the risk of harmful side effects. Yes, you might get a fever because your body's working to make those antibodies. You might get some redness at the site. Well, yeah, because your body's trying to get off the invader as it sees it. And, sometimes, like, you can get a rash if that illness, say, causes a rash, like with the measles. Vaccination, some people get a little um, little red rash, that's just because your body is working to prevent that illness, and also you're getting a small live inactivated part of that virus. So yeah, you might have a little rash that lasts for a day or so, but it's not the full blown illness, which can actually be deadly.
Okay, great. And the last misconception that I found on the internet says that natural immunity is better than vaccine acquired immunity.
Okay, so let's think about that. To become naturally immune, you have to have had the illness. They, the vaccines are made for against illnesses that can kill you. So yeah, you might have natural immunity, but you could also be dead at the same time because you were very, very ill. So that means you have to kill off large populations. Think about when Europeans first came to the Americas. Millions of Native Americans and First Nations peoples were killed because they had no natural immunity to those illnesses. So the result is, their children might have gotten natural immunity, but now you've lost all of your elders and your history and, your culture. So it's much better to get vaccinated, where you know that, okay, you might have a fever, you might have redness and swelling at the site, you might have some achy muscles, but you don't get the whole illness. And even though they're called childhood illnesses, things like chickenpox can still kill people, and it still does. If you're pregnant and you get like the shingles or varicella, you're supposed to tell your doctor immediately to get medicine because it can severely harm your unborn child and it could kill the mother. And I've seen both happen. And so, if you have concerns, definitely talk to your provider, but it's kind of like all or none. That yes, you're like, well, I got this and I'm immune now from that, but something else can come along that someone else is immune from, or they get immunity and survive, but you get it and you die. So there's really no good way to sort out who that's going to happen to. And that's why they're working so hard on vaccines and the vaccine for COVID-19. Because, we can estimate who's at most risk, but we can't tell you, oh, yeah, you're going to survive. Oh, no, you're not going to survive. And by the way, oh, you're going to survive after being in the hospital for 100 some odd days. So, that's not a good risk. That risk of what happens if you get sick to the benefit of the vaccine, it's just not there. So just get the vaccine and not have to deal with all of the severe illnesses that could happen.
Speaking of risk, we're going to quickly move into the fall season, which is also flu season. And I understand that there's a much higher risk of mortality, that the flu in combination with COVID-19 can kill a lot more people. Is that?
Yes.
Can you talk about that?
What happens is there's typically one or two strains of flu, like flu A or B, and however they name it for that year. And even if you get two flus viruses at the same time, you're really sick. You're in the hospital, very ill. So now you have a respiratory illness, the flu, with COVID-19, which is also a respiratory illness. That also makes it harder. Both of them makes it hard to breathe. It hurts to breathe. Now your muscles are weak. You're not getting in enough air. You can't really work the way you need to. You're not eating or drinking. And they both attack your lungs, which can lead to, pneumonia. And so now you're just, it's double, it's a kind of a double whammy to the same system. And we know that COVID is very bad. I mean, you're already in a hospital 100 days just for the respiratory problems, not to mention what it does to your heart or kidneys or multi-system if you're a child. And add on to that the flu, the medical system is going to be, I think, doubly overwhelmed. It's already overwhelmed when everyone gets that sick in terms of ICU beds. But now you put the flu on top of it, and you can end up in the ICU just by a bad flu case yourself. And if you have like COPD or asthma or any kind of congestive heart failure, yes, your chances do not look good for survival if you get both of those things at the same time. So you definitely want to get your flu vaccine. If they have the COVID vaccine ready by then, thinking about it and thinking about the risk, I'd say get your COVID vaccine too. And I don't say that lightly. I understand why people are afraid of new vaccines and why you might want to wait till the next year. But this is a pandemic. It's all over the world. It seems to come in waves within the same country. So the risk of you getting it and getting that sick and then maybe not having resources available to you are pretty high. So even with the new vaccine, the benefit outweighs that risk. So even if you should happen to get COVID, maybe you get it and you don't end up in the hospital and you don't end up on that ventilator in combination with the flu.
Right. Well, you've convinced me. I'm going to get my flu shot, and I'm going to try to be the first in line when that COVID-19 vaccine is available.
Right.
It's just like not worth the risk of not doing it.
Right. It's not worth the risk. And if, you're a parent or guardian, you want to be there to take care of your kids or your family. So you really have to take care of yourself first. And it's sort of a win-win because, yes, you're taking care of you, but you're also taking care of your community in that you're not spreading the virus around more because one person can infect hundreds of people and you don't want to be that person.
Absolutely. Well, I really appreciate you being on the show with this valuable information, and I hope that it will save a lot of lives and save a lot of heartbreak and sickness for the survivors because, surviving sometimes is a difficult process if you have body systems that continue to fail, like your kidneys no longer work as you recover from COVID-19. So I hope this is information that my audience will take to heart, and I'd like to thank you very much, Dr. Howard, for being a guest on the show.
Thank you. Right. Thank you very much.
So everybody be safe and well. I'll see you next week.